Hello, hello. Thank you for joining me today. This is the Spicy Pecan podcast.
Have you ever had a dream that you could do so you could.
Woohoo, you came back. Gracias, mi gente. Welcome to another episode of the Spicy Pecan podcast, and it is definitely going to get spicy today. So, the coronavirus has magnified the inequities in this country. This is going to be a more sobering episode, educating episode. We are very lucky to be joined by Moneke Singleton Ragsdale, who has been on the pulse of social justice in New Jersey, specifically Camden, for years. She holds many titles and roles within the community. We will discuss with her what she's seeing in the healthcare industry and some important information that we need to be aware of. Now listen, I am not a politician, nor am I an economist, but I am half Black and half Puerto Rican, so this coronavirus issue hits me a little differently. If you have not been made aware, it is ripping through both of those communities like crazy. And if you're watching the news and these press conferences, you may be sipping on some Kool-Aid. And I wouldn't feel right about doing a podcast in general if I'm not speaking to something that directly affects my community. I mean, we could do the jokes later, you know what I mean? So, especially since I have a lot of family and friends that are going to be listening to this, and I don't need to be kicked out of the virtual Thanksgiving. Like, I really don't. So, for anyone who has yet to understand the gravity of this virus, hopefully something that we say today will enlighten you. So, I want to start off by just saying anyone can get this virus. The two things causing people to die is the exposure to the virus and your ability to handle it should you get it, right? Both are hand in hand. African Americans and Latinos hold a lot of the jobs that are considered essential. Therein lies your higher exposure. Hold that up against a lack of access to health care. There are a lot of people out there right now that do not have health insurance today, who are basically forced to go to work because they're essential, and absolutely we need them, but we absolutely need to be taking care of them too. There's no reason why the people who are keeping us safe have no health care. I said this the last time, and it's not everybody. Some people have, listen, if you're a police officer, you work for the government in some way, you're going to have fantastic health care. But there's just such a gap between those who have it and those who don't. It shouldn't be a lottery. Now, if you haven't had access to healthcare in some years, you may have no idea that you have high blood pressure. You could be walking around with an autoimmune disease. You may not have a clue that should you get in contact with this virus, that it's almost a ticking time bomb. Put into perspective with numbers, 60% of the workforce for MTA, basically the SEPTA or public transportation in New York, 60% of the workforce is Black and Latinos. Think about CNAs, parking authority, fast food restaurants, all of these places that are still open. In terms of people who can actually work from home, people who can telecommute is what they call it. In this country, it goes in this order. At the top, it's Asian, then white, then Black, then Latino at the very bottom. People are getting sick and dying in their homes because they already know that if they go into that hospital, they're going to have some type of astronomical bill that they're going to have no way of being able to catch up and pay on. Is that the type of thing that you would want to be dealing with in this type of crisis? Within our community, we were already dealing with issues within healthcare, doctors not giving us the pain medications that we need because Black people are considered being more tolerant to pain or being able to sustain pain much more than anyone else. Because I know people look at the news and they think they know the situation, but the reality is there's a long-standing history here, very long-standing. I can tell you growing up, it was very common for me to hear people say they did not trust doctors and had a whole laundry list of reasons as to why. By now, everyone pretty much knows what the virus actually is and how it's transmitted. We know that we're keeping the 6 feet. If you want the actual details, please sit there on cdc.gov website. It goes over everything. Masks are now being required pretty much everywhere you go, on public trans, in your regular grocery store. So make sure that you're doing it. There are videos of how to create these masks on YouTube. I know the recommendation is you want to use a coffee filter or a paper towel in the middle between several layers, just to make sure that you are creating some type of filter. The way that you can test your mask is by putting it on and putting a lighter in front of the mask. Don't burn yourself, obviously, but put a lighter a little in front of the mask. I would say probably about 6 inches, and try to blow it. If it blows, obviously there's air that is freely going in and out. No good. Another way you can test it is if you're not going out right away, you can take a spray bottle that has, like a mist, like a sneeze would. You've seen all the movies with the freeze frame of how the sneeze actually look, where it looks like a mist, like you're throwing glitter. You're going to want to use a spray bottle and spray in the mask itself to make sure that it's not coming out on the other end. It can be transmitted by coughing, sneezing, and talking. It can be transmitted through talking. So understand that this is like playing Russian roulette, because if you get it, you may be fine, but you're not going to know until it's too late. So prevention is everything. Don't let anyone in your home. If I can curb my adult play dates, so can you. Certain countries have been lifting bans for us, or for people to get back to somewhat of some type of normal. What we're seeing in these cases, and in some cases, South Korea being one of them, is little mini waves of people being reinfected with the virus. We don't know enough about the virus to know if that is something truly alarming. Is it that when you get it the second time, do you have, somewhat of a protection so that it's not going to hit you harder? Or does it hit you harder the second time? There's just so much that we don't know. And I know people are super excited about the testing becoming more available, but it's a test. So, yeah, you're getting all the testing up to snuff. What, to tell me the good news? I am worried about a prevention. I don't feel like we are safe at all until there is a vaccine. Are we not in the same case that we were in quarantine day one? Does it not just take one person to spread this? Didn't it start with one person? People are protesting now because they want the country to reopen. And the saddest part about this is I know that the healthcare professionals in these areas where people were protesting, they had to have been furious. Do you not understand that some of these doctors and nurses haven't seen their own family for weeks and weeks and weeks? And we cavalierly just go out like everything that they've been doing is for now? Some of this I blame on the stimulus check, and let me tell you why. There is a very bad perception in this country that anytime the public asks for some help, it's a handout. And it's looked at as, ugh, look at you asking the government for anything. How dare you? Pick yourself up by your bootstraps. Get yourself together. Do you not understand? We give away a lot of power to these people who were supposed to be acting on the public's best interest. When the big businesses ask for it, it's a bailout. Its policy is so shiny and it looks pretty. It looks like something that we're doing as an initiative for the country. But let the people who actually live in the country need something, and you might as well be standing in a soup line. You might as well be looked at as if you are less than someone. I am a single person with no children. I don't get all these tax benefits. I don't see taxes, but I damn sure pay them. And I know how much I'm paying in comparison to what I am getting back on a yearly basis. And I can tell you that it ain't much. So I know that there are other people who are not getting much back either. I don't ask the government for shit because I don't qualify for shit. I either make too much, or because I don't have a dependent, it doesn't put me in any qualifying programs. So how is it that I need some assistance, someone who has paid their taxes, held sometimes 2 and 3 jobs, haven't gotten much back, and now in a time where we need help, You give us a scraggly $1,200 and give the biggest portion to companies that don't need it? The same companies that are laying us off?
Another point I want to bring to your attention is we're seeing strikes pop up everywhere, all over the place, different industries, and it's got me thinking, what is life going to look like for some people as we start to get back to quote unquote some type of normal? That is going to put a lot of pressure on businesses to create plans and have an idea of what they're going to do to ensure some level of safety. This also puts small businesses at risk for potential liability. So we may be seeing a rise of unions to supplement that relationship in ensuring that the workforce is getting their needs met in terms of healthcare, pay, and benefits.
Just remember, the people who are encouraging you to go to work, see where their kids are. See where their family members are. See if they're having them go on the front lines with a mask. See if Dr. Phil is telling them to put their kids back in school. When I see Oprah out and about, chilling, that's when I know it'll be safe. When I see celebrities going back to work, starting to do basketball games and things like that, and actresses are getting back on set, that's when you know it's safe. Until then, it is not. Please do not drink the Kool-Aid and allow these people to make you believe something that is simply not true. Your life is at stake, and I actually care.
Lordy Lord, y'all got my blood pressure up. It's really hard doing a podcast like this where you're talking about subjects that have such a deep history. Entire books have been written on certain things that I've just kind of breezed over. But I hope that you were able to get some information out of that, and I definitely got more coming for you. We're going to switch up the vibe just a little bit and go to a music break, and I'll see you on the flip side.
Can't touch that. Can't touch that. Can't touch that. Can't touch that. My mucus gets me so clogged, makes me say, oh my God, bless you. Don't come around me without hand sanitizer, Lysol, and bleach. That's good. When you wipe stuff down, super soap sponge with the good soap. Now I know life sucks, but here's a few things you can't touch. Top part of any shopping cart. Can't touch that. The handle on public restroom doors. Can't touch that. Any entree that includes back meat. Can't touch that. And oh yeah, people. Can't touch that. Fresh new gloves and masks, looking like a ninja that's kicking the ass of germs. With a bottle of bleach, wash your hands to the birthday beat. You alone and stuck at home. Watch your TV while you're talking on the phone. So since we all watch Fresh Prince, let's pause for a second and do the Aunt Viv. Everybody's stressed out. The light-skinned Aunt Viv. Can't touch that. The keypad for your EBT code. Can't touch that. That $1,200 stimulus check. I'ma touch that. Stop. Sanitize. Ronald's Peppermint Soap. Ronald's Peppermint Soap. Stop. Sanitize. Everything needs cleaning so we can win this fight. I'm about to scrub my face till it's Sammy so white. Now why would I ever stop doing this with others making parodies that just don't hit? I tour around the world, but I can't leave my place. Cause Corona taking over like Ebola, I'm a soldier with a Sammy Sosa face. Can't touch that. Can't touch that. Stop. Sanitize.
I hope you enjoyed that. That was Keith from Up the Block. That is actually his IG handle if you want to add him. Really, really talented. Has a lot of really good content on his Instagram page. And just a reminder to everybody, make sure that you are supporting your local content creators. People are doing some fantastic things out there right now, and some of it is better than the stuff that's on TV. I got to keep it real with you. So make sure that you're always showing them love. It takes a lot of work to get these things done, and most people are not getting paid for it. They just doing it off the love. With that being said, I want to introduce my guest here and go into the interview.
Thank you so much for joining me today. We are joined by Moneke Singleton Ragsdale. My aunt, she has been an activist in the city of Camden for years and years and years, someone that I admire to the moon. Thank you so much for joining me,
Aw,
PT. How are you?
I am fine, and you?
I'm good. I'm good. Always nice speaking with you. So, give us an idea of, tell us a little bit about the work that you're doing now. I know you always got a bunch of things going on, but your actual jobs, what are you doing now?
Right now, I'm a union organizer for health professionals and alliance employees, and that's all health professionals. I'm also still a telemetry technician at Virtual Our Lady of Lourdes, where basically break down heart rhythms and ectopy and report it out.
Oh, so you in the thick of it.
Yes.
What's the current situation? Are you going into the office? Are you working from home?
Right now, I'm working from home from my full-time job as a union organizer. Last time I've been at the hospital was actually March 2nd, so I really haven't been called in to work because I'm per diem there, so I work normally once a month.
Okay. So I wanted to start with, there's so much information going on right now, so much information being dumped on us. And, you know, our people, we love conspiracy theories because of
Oh,
so
yes, we
much.
do.
I mean, and legitimately so, because of so much history, and the things that have happened to us have been pretty wild. And someone would think, wow, that would never happen. So I completely get it. But where do you advise people go right now in terms of the virus in getting relevant information?
I would advise them to go to either the COVID updates that's in the state for the state of New Jersey, and it also does US and the surrounding, and also for WHO, which that stands for the World Health Organization. And it gives you kind of a breakdown, the updates. It kind of lets you know about the rumors, but the rumors that may or may not be true can change accordingly because they don't have enough information about this virus. Every day there's updates, certain type of mask, what mask is protection, how these viruses get infected, and how it's like starts from, 6 feet, now it's 12 feet, 13 feet, now it's like we can't bury the folks. So now even just recently as today is hospitals like we're not going to resuscitate a patient now if they have COVID. So the unknown is the scary part, and it's just like to protect yourself and be safe. It's kind of ongoing updates, but I try to keep up with like the most recent updates because it's very interesting. This is a very contagious virus and it's spreading like rapidly.
Yeah. In terms of testing, I know that they're doing testing now. There's testing sites. What do we know about the status or the ability to be able to test?
What I have found out is you can't just go to the test site and get tested. You would need to contact your primary doctor, or I guess the urgent care if you don't have a primary doctor. And they kind of listen to your symptoms. And when they listen to your symptoms, depending on your symptoms, they have you go there. And it's kind of cruel because it's like they want to send you there when you're severe, like shortness of breath, peri chest pains, loss of sense of smell. There's certain symptoms, and these symptoms are also changing too because everybody's not experiencing the same symptoms, but it's kind of different from what we're used to. We're used to, if anything's wrong, go to the hospital no matter what, if you feel it's emergency, till now you got to go through COVID's got to go to New Jersey State Health before they get you to go to a testing site, and then it's like an appointment basically to go to a testing site. And from what I read from the latest, a lot of them are just closing down because so many cases are coming. So it's like, wow, they really don't know how to handle this, but it's ever changing. And personally, it's not the same as just going to the hospital when you feel sick.
Right. How long does the test actually take? Do you know anyone who's taken the test?
I've known some people to take the test. I know that it's changing. I know Rutgers was working on a new test, but it was up to 7 to 9 days, so that could have changed. I know that Rutgers was working on one that's a turnaround, but that test itself is pretty intense, how they go down your nostrils into the back of your throat with a swab. Yeah. So it's kind of like the Results vary, and I think that's why, because of the results, that's why our numbers go from like week to week, because of the long stretch of how, oh, there was no deaths today, or there was no positive cases today, until that, wow, we got this so many and that so many. So it's ever changing. I mean, I know they're looking for a quicker turnaround, but it's kind of hard.
What are they saying in your field? What's kind of the idea in how we're going to move forward? Are they thinking, are we hypothesizing that tests are going to be needed to be taken before starting your job again, mandated for anyone entering into schools? Like, is anyone kind of having these conversations around you?
Not the school so much as the healthcare, and because I work at the hospital, like they started testing for fevers, which in my opinion, this is only my opinion, I don't think it's going to be an adequate test, because everybody doesn't have the same symptoms. So you can have a headache without a fever, you can have, shortness of breath without a headache or a fever. So it's all kind of interchanging, and it's kind of hard to say. And somebody can be asymptomatic for up to 7 days, even though they was exposed. So I think it's kind of hard, but that is one of the ways I do know that they're testing for healthcare professionals if they have a fever.
Okay, yeah, because I know that they are talking about restarting the economy. And the first thing I think about is, well, that's a great way to get this thing rocking again. Especially if we don't have the testing, if we don't know which one of our colleagues are, is positive or not, how do we even start to think about getting back into work in our regular lives?
Oh my gosh, yes, that is scary. I also follow China, since they were the first pandemic to happen. And looking at China, oh my goodness, like the ones who tested negative after they already had it and was positive and went through their course, it said some of them are retesting positive again.
That I heard that. And I was telling someone, I'm like, listen, even if you've gotten it, we don't know how long that quote unquote immunity lasts. We don't know if
Yes.
you're exposed to it again, do you get it the second time even worse? It's scary.
Very scary, and especially with the new drug that they're trying out, experimental drugs with it's like a drug they use for lupus, and it's also, I can't remember the name off the top of my head, but it's also an antibiotic. So if you are using that and you are recovered from COVID-19, but if you get exposed the second time, because what one of the side effects is that it damages your heart muscle, so your heart is weaker. So most people who get it the second time dies of cardiac arrest. So it's pretty scary. So I keep following, because I mean, like, I guess I have so much time on my hand and I want to help. I want to be a scientist. Like, I want to dig in and be hands-on, but I can't, because of course I don't have that background. But it's very interesting of how this virus evolved, and how so many changes throughout the weeks, throughout the days is happening with this virus. And I'm really like looking at China, like our 30 days, I'm looking like we probably be in the house until fall if we really want to make sure that this is all cleared. And we need to change some of the ways we're doing, like going to the supermarket. Yes, you need food, you need to go, but we need to start thinking a little bit wisely, like start getting preserved food, so we don't have to go as often. Or, some of the, like I was just at BJ's, the stocks are not even there. So you're not even going to get everything you want, and start shopping for a month or two. So we don't have to be at the market exposed so much, unless they change something and do delivery and have online deliveries, and where, very protective delivery people are coming out to your doorstep. That's the only way we can really minimize and try to flatten our curve of exposure.
Right, right. So the coronavirus has definitely made us all look at our health, how we're handling our health insurance, how seriously we're taking it. I told you, that I played around with my health insurance coverage just because I just wasn't taking it seriously like a lot of people. How important, can you just speak to the fact of like how important it is that every single person do everything that they can to be trying to get coverage right now?
Yes, I think it's very important, and especially since it's an ever-changing crisis we're having right now with COVID. It took weeks before the Congress was able to get the testing done that was, already paid for, when you had to pay for it out of pocket before. Also, the coverage of the insurance, I've seen bills, people getting medical bills, $34,000. Like, that's crazy.
Mm-hmm.
So I think it's highly important that you always stay insured and protected, and always be, dealing with your health and wellness in general, and always be proactive. That's one of the things that's most important, because just like now with this pandemic, you never know what can or will happen. And one of the things that I seen focus on, even our politics and everything, universal health care. And I think that is kind of crucial, because even with some of the top paying insurance companies, the insurance companies still can dictate what can they treat and not treat, and what testing you should go for and not go for. And I think that's one of the things people don't see outside of what they already hear.
Yeah, because what it really means is you're going to be shut out of certain things, and you're just not going to get sometimes even what would be considered appropriate.
Yes.
Okay. So
Yes. And I'm not a professional or anything, but like just looking at things and seeing and being exposed to things and being in that industry, because I used to do billing for patients, and a lot of stuff, is denied. And a lot of stuff should be preventive medicine, but insurance companies don't see it like that. And to be honest, the insurance company is dictating your health care, and they have more say over than what your doctor do.
And at the end of the day, they're a business. This is not a nonprofit. These people are not in this business to make everybody's life nice and sweet and healthy. They are in the business to make money. And if it ends up being a life that's sacrificed for a percentage point of profit, understand that these companies will take the percentage point of profit.
Speak about it.
What about PPE? Everybody's talking about PPE. What are you hearing from essential workers in the organizations that you're tied to? Does it seem like we're starting to get the supplies that we need? Has there been an influx, or are we still struggling on a day-to-day?
Well, there's actually a lot of things about the PPE. First of all, the PPE is very specific N95 mask. In the healthcare profession, there was a shortage. There's still a shortage. We're getting all kind of flack, but getting that information, we have not prepared for this, which is sadly because a lot of our hospitals and stuff is over private industry. They stopped stocking up on a lot of this stuff because, everything is about how much money we can make and save. So that was like one of the crucial things in the beginning. Not only did our hospitals haven't been prepared, neither has our government been prepared, even after our last episode in pandemic. So no one prepared for this, and getting it out there, it's really, really scary because it's happened so rapidly, where these patients should be in a low pressure isolation room, but we have like maybe 1 or 2 rooms on each critical care floor, maybe not on all the medical floors, but you have these patients who are coming in so rapidly that they're all over the place. The nurses who take care of the patients should be the only one going in the room. Where's the N95 mask? But at the same token, everybody that's working in that hospital, from dietary, environmental, housekeeping, unit secretaries, nursing assistants, still have to transport that patient from the ER to the floor. And then you open up all the floors, medical floors, critical floors, and units. They're not properly provided that PPE. And I think that is crucial. If it's an unknown virus where you don't have the statistical data that says when you have to change from 6 feet to 13 feet, from an hour cleaning the room to 2 to 3 hours, you need that information. And I think it's imperative that everybody is covered up in safety, because everybody's putting their health at risk going into work, and then their health at risk of leaving work and entering their homes to their family.
Right.
So the PPEs is it's a mask. They have different varies of mask. The stronger the mask, that's kind of the highest one, for not to, because they say the patient may or may not have a mask on, so they have some of them have respiratory issues, so they might not have a mask on. They might have oxygen and stuff. They're saying the more the patient is exposed, the more thicker mask you're supposed to have on. But I think everyone should have on that mask, because emergencies, a patient declining, like their condition can change, you never know. And it's literally that nurse in that room by themselves. So every exposure is all over, and I think it's very important that anybody, not even in the health field, but like look at the firefighters are getting exposed, police officers are getting exposed. They got parking ticket authorities working. Why are they working? I have no idea, but they can get exposed.
That is crazy.
Crazy. if our city hall is open, you can still go up there and make a tax payment. Wrong, should not be open. We should have delayed, payments. There should be an online or just mail it in. So there's so many things, and you can still see where people can be exposed, but nobody's really thinking about it. Even standing in a line at the grocery store, you can be far away. If they went from 6 feet to 13, hello, that thing is maneuvering, just stagnated in the air. So I think that's not even a good look. If it's 3 people in line, I'm not going to stand in the line. I mean, one person or however they let inside, I'm not going to stand out in line and expose myself. I'm going to give me a ticket, let me sit in my car or whatever, but people shouldn't be lined up. So there's so many things to think about. I wish people just treat this as like, I don't know. Yes, Ebola or worse. So just treat it like anything can happen. It's viral, it's droplets, airborne, it sticks on your shoes, like all this stuff they're talking about. It's like basically when you come home from being outside and being around other folks, you need to basically strip before you get into the house.
Yeah, that's what I've been doing. I got my outside clothes and I have my inside clothes, and
Yes.
I have like a box by the door. The shoes go right in. I wipe them down with bleach. Like, it's just not worth the other side of it. It's just I don't understand why more people aren't falling in line, but unfortunately some people just do have to learn through tragedy, unfortunately. But I want to talk about unionizing, because I think it's so important. Our culture, our American society has gotten out of protecting the worker and really
Yes.
honoring and glorifying companies.
Mm-hmm.
But I see that we're slowly starting to get back to where it is employee centric, or at least hopefully, and I know that you definitely have been on the pulse of that. Can you speak to the work that you're doing with the healthcare workers?
The work that I'm doing with healthcare workers is basically, as a union, representing them and helping them protect themselves, because normally they are the voice of their union, and there's people that's working in the field that's being exposed, that are scared, especially nurses. They are licensed professions. They know about some of these viruses and the precautions. Everybody's not trained in infectious diseases, so this virus would be an infectious diseases. So I'm working on a floor that we're not exposed to that, or I'm a brand new nurse. I might not know like some of the things. So as far as the hospitals and their administration, getting information out there, helping them help protect themselves is kind of hard, especially when everybody's just going off the handle and they changing policies quite frequently. As a union member, you have a voice. You can be like, wait, I'm the one that's exposed. I'm one of the ones who shouldn't be taking care of this patient. I don't have information, not denying your job or denying care, but being informed and be able to reach out. Let me call my representative and let me see if there's something that we can do without you losing your jobs. It's so sad for me to see anybody who's risking their life every day dealing with this pandemic where they get fired because they want to make sure that they're safe. People need to realize, especially these hospital professionals, that these are human beings who have to go home to their families. So if they get infected, they go home and they have to be away from their families. One of the things I like that Philadelphia did is they provided a hotel for
Right.
nurses to stay there. I mean, excellent idea. But I know everybody's going through things, but to have a protection, I feel sorry for people who are not unionized, who doesn't have protection, who can't have that voice, can't document this information. And when the information you document stays within the hospital. As a union member, I can say, this is wrong, this happened, this, whatever that, and I can document it, yes, with the hospital, but also with my union. So when they tried to come and retaliate on me to force me to do something because they don't have the numbers, this is where it's come important, because people should know most hospitals are already working understaffed now. And right now, just to make sure that their quota, when their beds are filled and to get there, they are pushing people to the limit. People are being exposed, and they're like, okay, if you don't have a fever, after 4 or 5 days, you still have to come back to work because you're still showing those symptoms, when they clearly mentioned that some people can be asymptomatic and you don't know your symptoms for 5 days and being forced back to work. These are key things, important things of having protection and having someone speak up for you, where you're not all alone and it's just you against the HR.
Right.
Where you actually have a representative that after this pandemic is over, whether you made the wrong move or right move, you're going to hash this out and sit down and have that voice and have that power that's working with you. And you can have as a union, that's members and powers where you can speak up. We need PPEs. We need them for all the people in here, not just
Hazard pay.
hazard pay. That's something you can fight with, having a voice. Very key. And having people take their time off and saying, I've been exposed without, saying, oh, you got to provide document. What I tell you about the test, maybe up to 7 days. I called out, you're not going to pay me until I produce the document, because the state told them that they have to pay for COVID sickness. So these are key things people don't understand. Yes, people don't understand. And hospitals, I hate to say it, the administration take every available advantage of this, because at the end of the day, you're just a number. They don't see you as a human or a person, and the safety and concern is not their highest priority. It's about making money.
How hard is it to get something like that in place? Say I work at Amazon. We saw Amazon strike about a week and a half ago.
Yes.
I work for
yes.
Amazon. This is not fair. I'm not getting hazard pay. They're not providing me with decent health benefits. I feel like I have no choice, no options. I don't want to lose my job. There's a better way that we could be doing this. How hard is it, though, to get these things, in existence?
It's very hard, especially if you're not unionized, because just by speaking out, they want to retaliate on you. As being a union, it's powerful. Like you said, you've seen Amazon stand up and fight, and it's powerful. They can put a monkey wrench right in their business. And the only thing that gets them to listen is them losing money. That's number one. So that was a very powerful mood, and the strike, to say the least, is one way to affect them and cripple them, to get them to say, okay, let's see what they're talking about, or let's see what they did. And then you see this article, oh, they're going to get hazardous pay. They're going to get this. I mean, it's very strategic. It's very structured, but this is why unions, and more time than any time now, unions need to be using the levy. The members need to be using the levy. They need to stick together. They need to be in solidarity, and they need to show unity.
If somebody works at a job right now where there's a bunch of employees and really, really terrible conditions happening, what's step one to them starting to approach coworkers? I know that I'm sure it's very scary, but what's like that first step to getting the ball rolling, to starting some type of union?
My first step, well, basically, I'm working with my coworkers. You have management telling me something that I know is not right, or it shouldn't be right, or that's going to affect my safety. That will be my first conversation. Look, this is going to affect our face. We have to go home to our families. What can we do about this? What should we do about this? And that should be the first conversation.
Okay. And I do really think that we are going to start to see a resurgence. Unfortunately, in this country, you've seen that we have turned our schools into businesses. We have turned our hospitals into businesses. Everything has turned to us glorifying the dollar and giving two craps about the average person when you're the average person in most cases.
Well, it all started when they had that legislation to take public entity and make them into private, and that's what started the ball rolling, because now our public entities can be turned into private, and the private entity is only interested in generating funds.
And to me, why are we paying taxes to a government who is no longer providing these institutions to us? It's like you're still charging me the same rate for this product, but I'm getting less.
Exactly. And that's kind of the thing. It's kind of like called pass the torch, pass the ball. We don't want to be responsible anymore. We can blame somebody else, but we'll, hands off, but still pay me.
And the thuggish, ruggish bone about it is, like, these businesses, they're not going to fail. Like, they're not going to fail by providing people with health care. And in any way, even if they do, it's an open marketplace. Another business will come along and take over that need because they got the model a little bit better. You know what I mean? Exactly. So it blows my mind how people are not really considering what is in their best interest.
Exactly. And if people really research how much revenue they made on a year, even though it takes them like 2 or 3 years for them to post it online, but where it become public access. But once you see how much they break it in, and you're like, oh, the business is going to fail because, they provided all Medicare. No, especially the big corporations. The small business may struggle, especially if you're just starting out, but the big corporations, not at all. they need to really look at what revenue they're generating and how.
So, one last question. Uh, the virus, they're saying that we're starting to hit like a flat curve, and I just kind of, or a flattening of the curve. And I just kind of wanted to get your opinion. When do you think that it is going to slow down and we'll see a lot less cases, or do you think that there will still be surges in different cities, i.e. cities like Camden, who it hasn't really hit yet, but we already know has a very weak infrastructure, and if for some reason it does, it's going to be very bad?
Actually, yes, just posted yesterday that Camden is getting hit
Okay.
pretty bad. Our numbers are surpassing Cherry Hill, mainly because of the lack of information and representative of our political arena or our ward leaders or whatever, city council. Everybody should be getting it out. Camden is unique because we're not so much heavily on the internet. With our seniors and stuff. Yes, they had the cops put flyers on the cars. Everybody doesn't drive in Camden. But just a present, like, come on, robocall, information in our mail. Like, this should have been happening like 2 to 3 weeks ago. Like, seriously, how important it is. And the removal, like, I've seen them remove some of the basketball courts and stuff. That's good, but a little too late. And how important, like, it's sometimes when people don't understand this important because it kind of hit Camden late. We got our testing site late, probably our supplies late. But just by them knowing the information and how detrimental this virus is, they could have afforded us that information to stay at home and what it means to be quarantined. Everybody, let's not assume everybody knows and everybody has internet, or we can go on Facebook and follow the mayor and what his instructions is. There needs to be a clear, precise information to get out there. It should have been mailed to the homes. We have all those senior homes in here, things that were put out. I would say congrats, and I really respect PBIC and Parkside, who's been getting that information out to their neighborhood. Rather it was, the updates or whatever, and they literally went door to door, block by block. And that's something that should have been happening in the city of Camden, because I don't know if you've been following it. Even our students are lacking with the supplies of computers and stuff, and trying to get all that information on the phone while you're homeschooling. It's too much. They should have afforded Camden more information. I try to get out as much as I can. I try to make it short and precise, but the reality is we should have had representatives that's, informed us as soon as that order went out, and like early as March 9th and the 16th.
Yeah, I mean, it wasn't even that long ago that I was following that story with you guys when they were trying to shut down Camden High. And I was interviewing students at that point. What was that, 2 years ago?
Oh,
3?
yes, that was up to, 2 to 3 years ago.
Yeah.
3.
That was 3 years ago. And even then they were talking about the lack of textbooks and just not having the resources that they need. So now you're adding this to it. And it's just like, how, just out of curiosity, how are they handling the schools? Is everybody getting laptops in Camden?
I thought, and then this is the thing going on reading the news, I thought everyone had it. There was just a post tagged on me yesterday, because I was trying to be one of the proactive, that was one of my biggest concerns. And I seen that we had all these laptops. But yes, I don't think they considered that every household did not really reach them. And I'm still following the stories on some of the things. And I seen where one of the students he has 6 siblings and trying to get their homework as a high school and falling behind on their skills. So there's a better way that we need to do outreach and take account of our things. And I think it's very concerning in Camden because we have so many different schools, different types of schools, and different information where we can't connect everyone in that one home. So right now, we're trying to follow to see who received and who didn't. And I'm watching their essays as they go up to see if there's some way that I can kind of intervene and help, because that's very important. If you got 3 children in your home and you got a high school, a junior high, and an elementary child, that's 3 different courses, which they're going to need 3 different laptops to either do their work. And I don't think no one considered that.
Wow. There's so much going on.
Thank you so much for doing this interview. You know I'm going to be checking in with you. This ain't the last time. This is not the last time, because you were always on the pulse of exactly what's happening. And honestly, just your nature about you, you're always dropping gems. And I always walk away from our conversations knowing something that I didn't know before, or being able to consider an idea that I hadn't even thought of. So thank you so much for supporting me and doing the show and getting the word out to people.
And I wish you the best of luck, and maybe next time we can have a little bit more fun.
Yeah. Yeah. Right now we got to get this information to the people.
Absolutely.
And that is our show today, guys. Thank you so much for supporting, all of the likes and subscribes, the shares, the comments that you're leaving, the direct messages that I'm getting. I just truly appreciate the love. I had no idea what to expect in doing this, and it's really cool to see the response, to see people actually connecting to certain things. I'm getting fantastic ideas from you guys, so thank you so much. Make sure you continue to like, subscribe, and share. And I will check you guys next week. Be blessed.
Thank you for listening to Spicy Pecan Podcast. This is a Wonderful Me Media production.